My name's Greg Tice. I'm the COO, for those of you that don't know me, of the Seattle Study Club. I want to thank Dave and Tanya and the entire Orem group for sponsoring tonight's program and helping us put this together. We are thrilled to be able to have the master of digital dentistry, Bob Margeas, presenting to us tonight. Sorry, Bob, I had to. Come on.
Hey, Greg, that's an oxymoron. Margins and digital dentistry? Come on, the
Yeah,
same phrase.
I had to fly to Iowa to show you how to turn on your computer.
Thank
So
you.
this will be interesting. Dr. Margis graduated from the University of Iowa College of Dentistry in 1986 and completed his AEGD residency the following year. He's currently an adjunct professor in the Department of Operative Dentistry at the University of Iowa, and he's board certified by the American Board of Operative Dentistry. He's a diplomat of the American Board of Aesthetic Dentistry, a fellow of the AGD, American Society for Dental Aesthetics, and the International Team of Oral Implantologists, the ITI. He's currently editor-in-chief of Inside Dentistry on the editorial board of Compendium, but his most important role is as one of the members of the Seattle Study Club's clinical advisory board, a clinical director for Seattle Study Club. So he's not going to be able to hear you, but everybody please help me welcome Dr. Bob Margeas.
Hey, Greg, thank you so much for that warm introduction. And I'm very excited tonight to talk about a subject that I'm no expert on, but I'm becoming one. I said, I actually, back in 1989, had the sixth CEREC 1 unit in America. So I went back and have been doing digital really since the 80s, but I really never progressed. I have a scanner. I'm going to share my screen with you guys here. Like I said, I've been doing digital for years, except not really. Having been a CEREC 1 user for 30 some years, I never really progressed past CEREC 1. But this to me was very interesting. I was introduced to a great guy, Mike Gerard, who is president of Orem, or he is one of the principals of Orem, and great guy. And he says, "Hey, how are you doing your all on X?" And I explained it to him saying that, I make dentures and then I'll convert the denture and then I'll verify it. And then I have a try-in and this and that. He goes, well, what if I could show you or talk to you about a technique where you could knock your appointment time down from 5 appointments to 2 to 3? And I'm all about profitability. Those of you who know me know that I'm about profitability and predictability. So I said, I'm very interested in it. And so Mike turned me on to Dave Costanzo, who kind of walked me through it. And they invited me to go to a seminar in Miami where they actually taught you how to do and use the system. So I'm going to talk about that tonight. I'm going to start this program and kind of give you a little bit of overview. It's going to be a relatively short program, and we'll be able to answer, some questions at the end. So this is what we're focusing on. What is Orem Tech Nexus technology? Why consider Orem Nexus technology? And how do I use it with my patients? Well, let me tell you, when Mike said, hey, I can show you how to do this and do all on X, I said, well, I already have my own lab. I already have a lab. He goes, no, I know people have their own labs and they work with their laboratories. I'm not asking you to send me all of your stuff, but what I wanted you to understand is this is one part of what we can do for you and help you. And we're partners with Nexus and Keystone Dental, and I want to show you how we can do it. So they've never forced me to say, hey, send all your dental work here or send all your laboratory work here. It's been more of a symbiotic type relationship over the last 6 months when I've learned this technology, because I've been doing all on X for over 30 years. And, I had my workflow and it was sort of going to be a disruption for me. But once I realized the simplicity of it, I said, you know what? I think I can help you. I'm happy to at least facilitate or introduce the system to people, not being an expert in it, but I've had some very, very good results with it. So let me share with you some of the things about what the Orem and Keystone partnership. They've entered into a co-manufacturing and co-distributing with Keystone to do either a full arch implant bridge, an FP1, FP2, FP3, and they're streamlining it. This program tonight is not about the surgery. It's not about how to convert a denture. It's not about, are you using a stackable guide, a surgical guide? This is more about how you can go from the provisional to a final in 2 appointments or 3 appointments. And so we're going to assume that the patient already has the provisional prosthesis in that we had made either on the day of surgery or a few days later. And we'll cover that. But there's going to be other webinars that will be offered that can go over that. How do we convert? Are you using a stackable guide? Are you going to use such a system called like Easy Pro? Because really the difficulty can be on the day of surgery, how are you going to convert? Are you going to use a denture? Are you going to use a surgical guide that's already in, the provisional is already in the surgical guide? And there's many ways to do that. So we'll be able to talk about that too. But what is the Nexus technology? All you really need is a scanner. It works with most scanners. You place these scan gauges in the mouth, you scan, and then you send the data, you upload it, and it's going to verify immediately whether that scan is accurate or not. If it's not accurate, obviously you have to rescan again. But you can do this while the patient is in the chair. So it's a complete system. No more scan impressions. No more impressions, no more verification jigs, and you do everything online. And so it makes it so much simpler. So I've had a scanner. I've had a scanner for 3 years. I used it for a lot of my implant stuff in the past, but I didn't really use it for crown and bridge. But to me, this is probably the easiest and most simple way to go from having the provisional to the final without having to waste a lot of time in a lot of appointments. So how does it work? Well, all you're going to do is follow the protocol of your patient's need. You take the intraoral scans, you take the patient's photos. We'll go over which photos you need. And once you've scanned those gauges, you're going to go on to Nexus Connect, which you're going to upload those images. And within a few minutes, it's going to, within really maybe I think about a minute or so, it's going to verify whether those gauges were accurate. And you're going to be able to go right to the final prosthesis if you want to. So let's look at this. You log into the Orem portal and you begin a case. You fill everything out online and you choose and to customize your prosthesis. You design it. You receive the design and approval, and then you can assess that design. Now, if this is something that the directors who are on this like, Orem will actually send their staff to your Seattle Study Club and provide hands-on workshops for your clubs. And not only that, they will send scanners, they will send scan gauges, they will cover all of this type of requirements for your referring doctors to incorporate this product and this technology. Now, for me, it was a little bit scared at first because not being a digital person, I was, skeptical. But after I worked with Dave and the Orem people, they reassured me that, hey, this is going to be a little bit easier for you once you understand the system. And, I was pretty fast at adapting it. Not being a great scanner to begin with took me maybe a few minutes longer, but the technology is super cool. And, you know, that's where I think the advantage is in doing these type of things. Now, a try-in is optional. What I mean by that is, let's say you have the prosthesis that you placed maybe on the day of surgery, a few days later, and maybe the occlusion wasn't perfect. Well, what you may want to do is, once you've scanned that patient, you can either have Orem design the prosthesis and send you a printed prototype that you could try in, or they could send you an STL file that you could try in and verify if you want to do that. Or you could go right to the provision, you can go right to the final, or they could mill you out a provisional that that patient could wear. So let's say I've got my prosthesis in, I'm ready to go to my final. I want to make my final scans. In the past, what I would have to do is I would have to scan the patient, take my prosthesis out, scan the patient, get a verification jig back from the laboratory, try the verification jig in and connect it, send that back. The laboratory would then send you a prototype that you would try in to make sure that it fit, or they would send you a jig to make sure that fit. And then you would have a prototype before you'd go to mill the zirconia. Now, with Orem, you could go right to the final zirconia if your provisional is good, or you can choose to do a prototype or a milled type restoration. On the day of surgery, what Orem is working on now, which will come later, is once the implants are placed, could you actually put the scan gauges on, scan the patient, have Orem design the prosthesis, and either send you the STL file or a couple days later send you a milled provisional? Yes. You're going to have to work that out with the laboratory, but that is one way of doing the provisional on the day of surgery. Or they could send you a denture, and I'll get into that later. That could be a breakaway denture where you don't have all these flanges to cut. So there's going to be a number of ways to do this. Tonight's program, as I said, is basically from the prosthesis going forward to the final. I don't want to confuse anybody on that. I want to make sure that you understand that. And then once you give them the final approval and the zirconia is designed, this is sent to you in a nice presentation box. The thing about this prosthesis, it's not a full zirconia prosthesis or a zirconia to a multi-unit. There's no tie bases in the zirconia. This is an actual milled titanium bar that is made, and then Orem will fabricate the top, the zirconia top that is bonded to that titanium framework that is then placed in the patient's mouth. So you have the ability to not have to use, number one, tie bases, not have to go directly zirconia to the multi-unit. You will have a titanium framework with the zirconia already bonded to that restoration, and all you're going to do is take it out of the box and screw that in. The fit is beautiful. These can be either gold anodized or they could be in regular titanium, but you have the ability to gold anodize that if you would like. And I will tell you that and Orem can get back into this. I believe there's like a 5-year guarantee on the titanium and a 3-year guarantee on the zirconia. And so they feel very confident about these type of restorations. Orem can get into that with you. So let's look at this. Listen to this video a second. There's more than...
It's nothing less than revolutionary. Over 12,000 implants.
Now 90,000.
This is tried and proved and tested. This is super efficient. I've been doing this 36 years. I can never imagine being able to treat patients this accurately with this type of efficiency.
You're not only delivering a functional result, but the aesthetics on it rival what we do at the highest level.
Shorter visits, because it can be done in literally 2 visits. And being that it's less costly, like photogrammetry, things along those lines, it certainly can bring the cost down significantly to make it better access to care for patients.
If you're not digital in your office and you have a simple intraoral scanner, this is not going to be a big leap of change or a leap of faith. It is very trainable. You're able to capture the implants in three-dimensional space, which you're trying to do with all the other techniques, but this is very accurate because of the algorithm that it uses. So you're now going to get restorations that fit passively within 10 microns, which is unheard of. The standard before was somewhere around 100 microns. We don't want to overload the implants. And by having something that passively fits over 4, 5, 6 implants, it just is a game changer.
It is going to change the way dentistry is done in the implant realm exponentially. What Nexus brings to the table is that wow factor that was missing from this type of restoration. Why would you do it any other way? I mean, it's the way to go.
There's so many different restorations that you can do. The beauty of it is, in the past, I probably made mistakes where I could have maybe done an FP1 instead of an FP3. And I was going with the technology. I was fitting the restoration. I was fitting the patient's anatomy differently than really what I should have done. I mean, they were blowing away a little bit of bone, more bone than may be necessary. The design team works very, very well with me. And you can really implement this pretty rapidly into your practice. You don't have to be an expert. You have to understand dentures. You have to understand the aesthetics of the face and where the teeth need to be. But once you get that down, the technology is so far advanced that it's inexpensive compared to like photogrammetry. And I think it's easy for you to get into it. So when you look at this, once you put those Nexus gauges on, when you buy this kit, your kit is really made for you. If you lose a scan gauge, you can't have another scan gauge made. These are not like a plastic scanning abutment or ones that you buy and maybe they get damaged, because this has to be very, very accurate. You have the scan gauge and your laboratory has the exact same type of scan gauge in their computer, and the algorithm is really for that scan gauge. So I may have scan gauge kit number 1, Dr. B may have number 2, Dr. 3 may have number 3. And so it's really specific for you. The technology really has made it as accurate as, or more accurate than photogrammetry, where it's a $40,000 investment to have one of those cameras in order to determine where the implant position is. So let's take a look at these scan gauges. What you're going to do is you're going to take your scanner, you're going to put the scan gauges on, and then you're going to scan from left to right, and then you're going to come back and you're going to scan from right to left. You notice that when you're scanning, you're not going back and forth. You're doing it in one swoop. And then you're going to go back and you're going to scan from left to right. If you went from right to left, you're going to go left to right. And then you're going to upload these images on the Nexus Connect site, and it's going to verify that these were accurate. It shouldn't take more than maybe 30 to 45 seconds, and then you're going to upload that to the site. So this is the Nexus Connect. This is where you take your data and you're going to upload it to the Nexus Connect, and it's going to verify it. You can see the blue there has been very accurate. No more verification jigs. and it will tell you right there, success in real time while the patient's in the chair. And as I said, this is available through Orem, and you're able to, scan immediately. The validation software verifies your scans. It's free. And really, the thing that probably turned me on more than anything was the amount of chair time that you can save going from, 5 appointments. Because when you think about it, from the surgery to the prosthesis to the making either the scan or the impression, then verifying, and then a try-in, and then a final. Now, let me tell you, when I first did this, my first case, I was skeptical. I had verified it, and I'm going to show you those cases towards the end. Because not being a great scanner, I was a little bit nervous, a little bit apprehensive. Why? Because, that's a big mistake. That's a costly mistake if it's not accurate. And so for me, I was a little bit skeptical. So what did I do? I had them send me a printed copy of what my final prosthesis was going to be. I had the patient come back. I removed their prosthesis. I screwed in the printed one, checked the bite and verified it, and it was perfect. And so I said, I didn't use it as a provisional. I just used it as a verification to look at the aesthetics and make sure everything fit. It fit, so I went right to the final. Now, the second one I did, I said, you know what I'm going to do? I'm going to do the same thing, but I'm going to make a provisional that I can screw in, a milled one that the patient could wear for a couple of weeks. And then the third one, I just basically went right to the final. So I felt very confident that once you get that verification success, you can go right to the final. So the only tools you need, any intraoral scanner, I should say most intraoral scanners, the Nexus scan gauge, and this is what you do. They have different heights. They may have a 3 millimeter height. I think they have a 5 millimeter height. You don't want these gauges to impinge on the tissue. There is a key to how do you place these scan gauges. They have to overlap each other. There is a learning curve, and Dave Costanzo walked me through it. And he said, you know what? If you have the patient's surgical guide, let's say you have the guide and you have that model, you could actually put those gauges on and see the best order that they are, take a picture of it, and then you go to the patient's mouth and you put them in the same way. Because you are putting those in the mouth, you're turning, you screw it, and then you may have to turn it a little bit, because there is a technique on how these go in. You want to cover as much of the tissue as possible, but you also want to have them kind of overlap each other, sort of like in a horizontal manner. What are the benefits? You can transform your full arches. You get a passive fit, reduce the patient appointments, like I said, and it's compatible with all MUAs. So if you were doing BioHorizons and you had an MUA, the scan gauge would fit on that MUA. If you were doing Nobel, if you were doing Straumann, they fit on most multi-unit abutments, placing them, scanning them. Now, one of the mistakes that I made, let me tell you that on the day of surgery, it's not always possible to tighten that multi-unit to 35 Newton centimeters. Like most of them are 35. But you may only torque it to 15, 20, depending on the insertion torque of that implant. So when the patient comes back and you remove their provisional, you got to remember to go back and re-torque the multi-units. Well, let me tell you, on one of the cases I did, I put the scan gauge, I took the provisional off. I didn't re-torque my multi-units. I put the scan gauges on, made the scan, verified it, everything was great. And then Dave says, did you tighten the multi-units? Oh, no, I didn't. So what did I have to do? I had to go back and redo it. It was a learning curve. And so you always have to remember, you gotta retighten those multi-units on the day that you're making the scan, or it will not be accurate. So let's look at this. They can do either like a Nexus bridge, they can do a Nexus hybrid. You can see that the titanium framework is either going to be a Zirc is going to be placed with no pink, maybe a little bit of pink, or a lot of pink. You have to decide FP1, 2, or 3, much less bone reduction. And so when you look at this, it's the most durable and it's the strongest, and the fit is amazing. And so I think that once you see this, it may change the way that you design or you actually order your hybrids. You know, up until now, I was only using full zirconia. I started with hybrids where I had the wraparound bar and then the teeth would break off. And then I went with zirconia where I had the tie base that was bonded to the zirconia. Then I went from zirconia directly to the multi-unit. And now the titanium bar to the multi-unit seems to have the best fit for me. And, you know, you don't have to worry about any of the tie bases coming out of the zirconia or debonding. And so it's much easier and more predictable. So let's look at a couple of my cases. This was the first case that I had done. This patient really needs to have an upper done too, but wasn't ready and didn't have the money to do everything. So what I'm going to do is we had her lower teeth extracted, and what you're seeing here is a pickup impression, of a pickup provisional that I did the day of surgery. So on the day of surgery, the surgeon placed the implants, I put the multi-units on, and then I took her denture and I converted her regular denture to this hybrid, all on X. I think there were 6 implants here. You'll see this as we go along. You can see that this was picked up on the day of surgery. Now, one of the systems that I really like is called Easy Pro. You know, when you're doing these provisionals on the day of surgery, a lot of times we're putting the multi-units on, we're putting the titanium cylinders on, and then we're cutting big holes through it to try to capture all of these things. This actually was not Easy Pro. This one was, I think, the smart denture conversion where I had to use titanium cylinders. With the Easy Pro, you're actually going to put a titanium coping over the multi-unit, and you're going to pick it up like a locator. And when you pick it up and it's incorporated into your provisional, you're going to drill through the bottom, through the top, so you have very, very small holes. It makes the prosthesis so much stronger because when you have bigger holes like this, you have the titanium cylinder, you're trying to fit that prosthesis over the titanium cylinders, and these holes get a lot bigger. So I prefer to have smaller holes and being able to pick that up. We may do another webinar for your members or anybody who wants to see it on maybe the Easy Pro conversion, because Orem is one of the distributors for the Easy Pro system. And I think it saves quite a bit of time. So you're seeing this prosthesis. The prosthesis fit really well on the patient. So what I did is I unscrewed that, and if this prosthesis was not good and the occlusion was bad, then I'm going to have to probably go with a try-in. But if the occlusion was good and the aesthetics was good, I can use this as my final guide to have the laboratory go ahead and mill me my Zirc. So what are we going to do here? Well, you're going to take the provisional off, and now you're going to place some scan bodies into these titanium cylinders. Now, in this particular case, there were 6 implants in this case. The one on the left, if you see the prosthesis on the left, that was tooth number 30, the first molar. When I made when the implants went in, The last implant was not stable. So I had to bury that one. That one was buried. I didn't put a multi-unit on, so I went all on 5. In the final prosthesis, we're going to have 6. So here is what you need to do. You remove the prosthesis, and now this is what it looks like. We've uncovered the back one, the 6th one on the lower right. And what you're going to want to do is you're going to want to retighten these multi-units. Because if you don't, it's not going to fit perfectly, because when you go to tighten that, it's going to go down a little bit more. So the first thing you want to do is to remember to retighten those multi-units. What I've done here now is they have these scan bodies. What these scan bodies do is going to tell you, it's going to scan the tissue, and it's going to tell you the orientation of what your provisional is, because you're going to do a 360 scan of your provisional too. Now, what would I normally do if I was doing analog? I would make final impressions of this with an open tray, send that to the lab. The laboratory would send me a verification jig that I would have to connect, and then send that back to the laboratory for them to fabricate a provisional. What I'm going to do here now is scan this, scan the tissue and the gauges, and this is what it looks like on my Trio scanner. And then I'm going to put some scan bodies into my provisional, the same areas that I had, so that they're going to be able to place the orientation of this into the digital file. So I'm going to hold this in my hand, and I'm going to literally scan the intaglio surface. I'm going to scan the teeth. I'm going to scan the occlusion. I'm holding it in my hand. And you can see that I was able to scan this 360 of that prosthesis. Now, after you have those scans, before I took this off, I did scan the opposing and I scanned my bite. I want to cover that first. I scanned the opposing, I scanned my bite, and then I'm going to scan the provisional. Now, I'm going to go into the mouth and I'm going to take these scan gauges and orient them the way that, you know, the instructions want you to do it. And I'm literally going to take my scanner and I'm going to start on the left side. I'm going to scan, I'm going to hold the scanner. I'm not going to overlap. I'm not going to go scan, scan, go back and scan. You want to do it in one sweeping motion. I'm going to go left to right, covering all of it, just kind of going back and kind of tilting it so that I can get all of these little nuances of these scan gauges. And what I want to do is tilt my wrist, scan, go to the left, then I'm going to come back and I'm going to go to the next scan, scan, left to right, right to left, left to right, okay? And then what do? These are my scans that I made. I'm going to go up to the Nexus Connect and I'm going to upload this file to the Nexus software, the Nexus Connect. And they're going to give me a verification saying it's either successful or it's not successful, or they're going to recommend rescanning. And sometimes they're going to say, oh, this is pretty close. You might be able to get away with it. If that's the situation, you might want to go with a try-in. But if you get the verification that says, hey, this is 100% verified, you literally, from your provisional that you sent, the photographs that you send, you're going to send a smile picture, you're going to send a retracted view, you're going to send repose, you're going to then get a guide or a digital design, and you're going to verify it, and you can say either go to my milled provisional, go to a prototype that either they're going to send to your printer, or they're going to print it and send it with it, and you can either try it in or you can go right to the final. That's how simple that is. Because in the past, obviously, you didn't want to go to the final because of the cost if it didn't fit, if it was a misfit. So what you're seeing here is the printed prototype. And on the right, you can see the final restoration. And so what I want is to verify it, make sure everything looked good, because this was the first one that I had done. And then I can go to the final. So I'm just showing you those pictures. Here's the prosthesis, the occlusal view. Notice the hole's very, very teeny for the Zerk. This one I did not gold anodize. I think I probably forgot to, but I don't think there's a reason not to anodize it. I think maybe, maybe it's a little bit warmer. But this now, I'm going to take my provisional off and I'm going to do the screw test. I'm going to put this on. I'm going to put one screw in on the right and I'm going to see if there's any movement at all. Then I'm going to take that screw out. I'm going to go to the left, put that screw in, see if there's any movement. Maybe I'll go to one more and see to make sure that it's very, very passive, because if it's not passive, obviously you're going to have screw breaking or screw loosening. These are just torqued to 15 Newton centimeters, and very, very simple. And here's what she looks like. Now she'll be ready to go with the upper. She wasn't ready yet. We made them slightly, obviously, lighter, but she didn't care. And then we filled the holes with composite resin. Lateral view, very, very nice occlusion, sits well on the tissue. The patient's easy, it's easy for the patient to clean, and so forth. And so that was the first case I had done. Now let's look at a second case. This patient came in with a lower, and so I wanted to have all the teeth extracted, place the implants, and then I'm going to pick up the denture again. Now, as I said before, Orem can do the full design. They can do the surgical guide. They have a system now that have magnets. They have a foundation guide, a bone reduction guide. Everything, once the bone foundation guide gets placed, they can use the surgical guide that there's magnets. And so the magnet clips into the bone reduction guide. You can take the bone down. Then you can put the implant guide in, place your implants. Once that's done, you can put your tie bases on using Easy Pro. You place your prosthesis magnetically in the guide and you pick it up. So it's a complete system. So if you want to go immediately, you can go ahead and pick it up. If you want to wait, you can have them design it and send it to you in a couple days. Or if you plan ahead, you can scan the patient using either the Nexus gauges or photogrammetry and have a prosthesis sent to your printer for you to print and insert that same day. So what we did is we had all the teeth extracted, and here's the prosthesis, and you can see here, this is just the provisional. Now that I had Orem make me a provisional that I could put in that the patient could wear for a couple weeks, because I wasn't 100% sure if she liked the design of it. She was kind of confused on if she liked it or not. And so I waited. And then what did I do? I took that prosthesis off and I put the scan gauges on. Now, when I did this, I had to change one of the scan gauges because as I was scanning, it was not picking up one of those very well. So I ended up having to take it off and I had it go. One was a little bit too tight to the tissue and it was impinging on the tissue, and that's what you don't want. But it told me that it was not accurate. And it said, this is the one that I would probably do, and it has colors on it that will tell you, is it good or is it not good? And once it was verified, I felt confident about it and I went right to the final. Here's the final prosthesis. This one was anodized. You can see. And when she's ready to do the top, she can do the top. So what do we need? What do you need to send to the patient? What do you need to send to the lab? Even in pre-planning, you want to have the patient full face. You want to have biting. You want to have smiles. You want to have retracted. These are required. These photos are required, after immediate changes are required. So if if the changes aren't, if you like everything, obviously you can still send the photos. And when you scan the patient and you're scanning the prosthesis out of the mouth, you can go right to the final if you're not going to really change much. So here's the final insert. This is somebody else's case. This is not my case, but the retracted view in occlusion and occlusal view. Now, after the design is done, you can go, as I said, right to the final, and you're going to be talking digitally, or you're going to be talking to the laboratory, technician prior to you getting any of these restorations back, because you can make those changes quite simply with digital. Before, when I was having to do analog and I was sending stuff back and forth, if you would have told me that I was going to be doing this, digitally, I probably would have said, no, I wasn't going to do it. I mean, Gerard, he kind of pushed me into it and said, hey, just try this out. If you don't like it, go back to your analog way. And so people laugh at me. I mean, they say, you're giving a lecture on digital dentistry. And I'm not here to tell you that I'm an expert, because I'm not. I've done 3 cases. But I think it's a system that really, merits looking at. Now, you can go from the digital design, put it in the patient's mouth, to the prototype, to the final. Let me show you. So here you have fully digital, no verification jig, no impressions, and you go right through the final. And so for me, it's been a game changer from a standpoint that I'm able to incorporate it into my practice without having to buy a bunch of expensive stuff. If you don't have a printer, you don't need a printer. All you need are the scan gauges. You can talk to Orem because they distributed scan gauges, and I believe there's like a discount, and I think of over $1,000 for the scan gauges. You talk to them about that as a Seattle Study Club member. And if this is something that interests you, they will come to your study club and put the program on for your restorative docs, walk them through it with the models, with the scan gauges, showing them how to upload all in one nice package. Or if you think that your restorative docs will like it, we'll give this webinar, and at no charge to you, to get your doctors interested. So what else? This is a full implant solution, where this was the guide that I was talking to you about. On the left, you see the patients had the surgery, and now you want to pick up that prosthesis. This can go right into the gauge, and now the Easy Pro in the middle is really cool, because you don't have to have any holes in your denture when you're doing the pickup. You're literally hollowing out the area like you were going to do a pickup for a locator. You try it in, and you literally take acrylic, you put it in the denture, you push it over the titanium coping, you let it set, and then you take like a cotton plier and you pop it up. And once you pop it up, you're going to then drill the hole through the bottom. And so the hole coming out the occlusal surface is super small. I've got a program for that. If you're interested in having an Easy Pro system, I'm happy to come back on and show you how to do that. This was really cool, this breakaway denture. When you look at that denture, the hard part of us doing these conversions are you take you got to be a lab man. You got to grind that flange away. But if you have this like this, that's a breakaway flange. All you need to do is cut those little struts off, and you've got, a conversion pretty easily. So that's the Easy Pro. This is a little teaser for you on how to do conversions versus using a titanium cylinder that you have to pick up and do that. The other one that was advertised before was the smart denture conversion. That was good. I think this is just a little bit better mousetrap. I've done both. I've gone with titanium cylinders, I've gone with smart denture conversion, and now I'm going with Easy Pro. So that's just something I wanted to show you. So thank you so much. And if you decide that you want to have hands-on programs, you can work with Orem. They're not going to try to get you to be their only lab. And, you know, as dentists, when we go to these meetings, you walk around, you see these laboratories, you don't want to stop because it's like almost embarrassing. They're trying to sell you something. They're not trying to sell you something, but they're the distributor of this, you know, and so that's what got me interested. So I can't say enough good things about Dave and Mike and Mark and Orem. You know, they've just been great to work with. So if there's any questions, happy to try to answer. If I can, I got my man, Dave Costanzo here. He's going to come in and answer it. Because I'm not going to try to bullshit you and say I have the answer if I don't have the answer.
So there are, Bob, thank you. That was terrific. There are a couple of questions. First one is, can I do this at the time of surgery?
Yes, you actually can do it at the time of surgery. You could put the scan gauges on just sort of like what you would do with photogrammetry and upload it and verify it. Now, either you're going to have to work with Orem and say, hey, I'm going to try to do this on the day of surgery. They're going to have their guy design it. It might take an hour or two. They can send you the STL file and you print it out, or you can do that, and then in a couple days they could send you a provisional. Would that be correct, Dave?
Absolutely, Bob. It was Dr. Hegney who had asked that question, and that's exactly it. We could do the just in time by providing the doctor in probably an hour and a half to 2 hours, the STL file that he or she could then print and then deliver. That's a nice clean way of putting a provisional in. Of course, there's always the next day or the day after, should the laboratory be involved in actually printing and or milling that provisional, we could do that as well. Yeah,
Okay.
both surgical front end and back end solutions are available.
Brilliant. Dave, I'm guessing this next one's for you, but Bob, you may know as well. What is the average lab cost per arch?
I'll tell you right now, I know exactly what it is. It's about 5,000 an arch. And that includes everything. That includes, you know, if they sent you a provisional, there may be an additional cost. But when they sent you a printed prototype, I think it's part of the cost. But Dave, go ahead and answer that one.
Yeah, you're spot on, Bob. The prototype, if we print it or if we simply send the STL for the doctor to print it, because some docs wish to print their own. There are no additional fees for the prototype try-ins. 5,000 is the price point, and it's no matter if it's on 4, 5, 6, 7, 8. It doesn't matter how many multi-units are beneath the final prosthesis. It's the same fee. And if it's an FP1, FP2, or FP3, again, it stays constant. So from the referring dentist standpoint, it's very, very predictable. And for the surgeon, it gives him or her the luxury of placing one additional implant and not potentially compromising the referring dentist's referral estimation to his or her patient. So it's kind of win-win. Ultimately, the patient is the big winner with fixed pricing.
That's great. That's great. So there is one more critical question, but before we get to that question, I want to make sure we were clear on what the opportunities are here educationally with Orem as well. So we will be doing another one of these webinars that you are able to invite any of your members to. We'll put this out to them as well, just as a general hosting. But you also have the opportunity to do this with your study club if you choose, as a Zoom in webinar type program, one-on-one with the study club, with your club and your members. Over and above all of that, if you want to go deeper, Orem will come in, their team will come in and do a hands-on session with this, with all of the equipment, all of the materials necessary to walk through that. So, which is a very generous offer. And Dave, thanks for that. I think that'll be terrific. So here's the final question. And it goes to John Wallace. So Bob, you know where this is going, but John Wallace wants to know, I'm going to put my glasses on so I can read it verbatim. Why are you so bald, Bob?
I can't even believe Wallace is on here. I begged Wallace to come on. I'm very happy that he's on here and has that question. Listen, I'm just I'm gonna throw a shout out to Ray Hagney. Ray, I think is in Granada, tomato. I love Ray. Ray is a gem of a guy, and he said he was going to be on, and he is. So he's one of those guys that I think he's already signed up to have somebody come out and do this program. Listen, Greg, I was talking to Rob Ritter today. I said, I gotta go. I'm doing my digital implant. What do you Ritter goes, what? I said, yeah, I'm doing. He goes, oh, you're an expert now on digital? I said, I'm an expert more than you on the Nexus scan gauge. I tell you that much right now.
Brilliant.
Oh,
Brilliant.
but
Well, again, Bob, thank you. Dave, thank you for what you did. And I think an important thank you to Tanya, who's really been behind the scenes putting all of this together. So we appreciate it. And this will happen again. And we're looking forward to seeing everybody very soon. Thanks, everyone.